Anthrax in humans is a frightening yet preventable bacterial disease caused by Bacillus anthracis.
The characters, names, places, events, or information shown in this video are either fictional or collected from publicly available sources on the internet. We do not verify, confirm, or authenticate any information related to medical advice, religious beliefs, historical events, or any individual mentioned in this content. If any resemblance to actual persons, locations, or sentiments, religious or otherwise, is found, it is purely coincidental, and the channel authorities are not responsible for it. This video has been created solely for educational and entertainment purposes. Viewers are advised not to take any information from this video as factual or professional advice. Thank you for watching.
Anthrax in humans is a frightening yet preventable bacterial disease caused by Bacillus anthracis. The germ forms hardy spores that can survive in soil for many years and typically reaches people through contact with infected animals, such as cattle, goats, sheep, or horses, or their meat, hides, wool, bone, or blood-derived products. Farmers, veterinarians, butchers, tannery and wool mill workers, and others who handle animal materials are at higher risk. Importantly, anthrax does not usually spread from person to person. Exposure to infected animals or their products is the main route. The disease can enter the body through different pathways, and symptoms vary accordingly. The most common form is cutaneous anthrax, accounting for the vast majority of cases. After handling contaminated hides, wool, or meat, an exposed area of skin may first feel itchy or irritated, forming a small bump or blister that can ooze. Within days, a firm sore with a black center, known as a black eschar, develops. The surrounding skin often becomes swollen, yet the lesion itself is typically not very painful. Fever, malaise, and swelling of nearby lymph nodes may occur. Symptoms usually appear 1 to 7 days after exposure. With prompt treatment, most cases resolve well, but delay can allow the bacteria to enter the bloodstream and cause life-threatening sepsis. Inhalation anthrax is the most deadly form. It occurs when spores become airborne, often during processing of animal hides, hair, or wool, and are breathed into the lungs. Early signs can look like an ordinary cold or flu: chills, headache, fever, and a dry cough. Then the illness can suddenly worsen with severe shortness of breath, intense chest pain, nausea, vomiting, and sometimes coughing up blood. Respiratory failure and shock can follow quickly. Symptoms usually develop within 1 to 5 days after exposure. This is a medical emergency that requires immediate hospital care. Gastrointestinal anthrax results from eating undercooked meat from infected animals. It often begins with fever, nausea, severe abdominal pain, and a sore throat. The belly may become distended, vomiting or stools may contain blood, and ulcers or blackish lesions can appear in the mouth or throat. Symptoms typically start 2 to 7 days after exposure. Without timely treatment, dehydration, bleeding, and rapid deterioration can occur. Early recognition and strong supportive care are critical. Injection anthrax has been reported among people who inject drugs using contaminated needles or substances. The injection site can rapidly become swollen, intensely painful, and discolored, with a dark or black lesion that expands and invades nearby tissues. Fever and profound weakness are common, and the infection can